Hello friends, welcome back one more time on the new videos on the Dr. Nilesh advice. Today's topic is the common topic dust allergy or the allergy which goes to the inhalation, what we inhale and we develop the allergy. So that is known as a dust allergy or the inhalation allergies. Now once in a lifetime everybody develop this kind of the allergies. It is common nowadays because now we are having the more urban population, so we have started staying more into the cities. In the cities the situation of the dust allergy or the inhalation allergies keeps on increasing. The wealth of the people keeps on increasing, so the devices like the air conditioner, air coolers are there into the buildings, and that's how the dust allergy increases. Now how to go about the dust allergy, how to know whether we have really dust allergy, what are the steps you can do at home to control the dust or the inhalation allergies, when it is a need to go to the doctor, what are the treatment modalities also available. Those are the things we are going to talk in this video. Before going to main topic, I just want to clarify few things that these all are the educational videos. These are not meant for any kind of the promotions or any kind of the monetary gain, and whatever fund I am getting from the YouTubes, it is going to get utilized for the charities in the developing countries like the India, Pakistan, Bangladesh, where I am doing some of the charities. So these are the videos are not used for the commercial purpose or the monetary purpose. So I don't have the pressure of any pharma companies or any medication managing companies or any hospitals to give you this kind of the videos on the YouTube channel. So you can share this video fearlessly with any of your family, friends, colleagues, and basically to give them the correct information rather than going to the commercialized informations. Okay, let's come to the topic about the dust allergy or the inhalation allergy. So basically inhalation allergies means that whatever substances you are inhaling and the body reacts to it. So all the allergies are basically body's reactions. So whether it is a skin allergy or the inhalation allergy or the food allergy, all those things are the reaction of the body. When you might have seen that when the child starts eating the food, many children develop the egg allergy or the peanut allergy. So once they will consume the eggs, body will start developing certain amount of the chemicals, and those chemicals will cause the issues in the form of the skin rash, coughing, sometimes the choking, sometimes lowering down the blood pressure, based on the response of the body and based on the allergies to allergies. Okay, so inhalation allergy in that way it is common, but it is not that much harmful as per the food allergy, because food allergies we have seen that the children get sick also very fast, many times their blood pressure goes down and they have to visit to the emergency, and sometimes they require the medications like the adrenaline, steroids and all those things. So far the inhalation allergies are bit okay because the symptoms are also manageable, easy medications are available, and the less side effect like the safer medications are also available to control the inhalation allergies. Now so whenever we are inhaling the certain type of the chemicals or even the simple dust, it will pass to the nose, then the throat, then the airway, then to the lungs. So most of the symptoms which comes are from the basically nose and from the throat and the airway. So like if you have just the simple allergies, then you might have developed a certain kind of the recurrent nasal discharge. You might have seen that when you go to the beach and if you stay there for a longer time, and if there is any dust storm or the sandstorm, your nose will start getting watering. So that is the body's response. So that is a nasal allergies. If the allergies is getting progress, then it will start involving the throat and the airways, then you will have the recurrent cough. So many time what happened that when you lie down or when you are in the sleep, at that time you will cough, and in the daytime there will be no cough. When you wake up in the morning, you will have lot of sneezing. After then throughout the day there will be no sneezing. Many times the symptoms, associated symptoms, like you will have the watering of the eyes also. So watering of the eyes, sneezing, running nose, cough, those are the main symptoms of the nasal allergies, like the dust allergy or the inhalation allergies. It is very common in the countries where there is a deserts, where there is a lot of gardens and lot of pollens, and our body gets sensitized to it. Body has a threshold to tolerate it. Once it is going beyond that, then the body will start showing the symptoms of it. So which are the common type of the inhalation allergy? So dust is in the top most in the list, and as it is dust, there is always a dust mite, because what will happen that when there is a thicken, you can say like it is like the dust which will get conglomerate, which will get gathered out, and they will form like the dust mites. So dust mites are basically like the movable or the suspended material, and that you will inhale and the body will react to it. So dust mite is one of the very common allergen, or so the allergen means whoever is causing the allergy, that is known as allergen. So the dust mites are the common allergen. The pollens, the animal dander, then cockroaches, those are the very common allergens. So in the affluent society, like the parents are keeping more soft toys in the house. So the soft toys, the fiber of the soft toys collect lot of dust, and it will form the dust mite that the children will inhale. So there is like the tradition by the parents, I don't know whether it is by the parents or by seeing on the medias, they keeps on buying the soft toys, and the children sleeps with the soft toys. So the soft toys, the material of the soft toys contains lot of amount of the dust, and the children sleep with it, and they will inhale those fibers of the soft toys as well as the dust of it, and then the children develop running nose, cough, snoring. They have to breathe from the mouth to take a breathe. So those are the things developed by the soft toys. So I don't encourage to keep a more soft toys into the house, like the dolls, teddy bears, which contains like the fiber textile material and which collect the dust. So I always advise to put or the pack those soft toys into the plastic bag, so the children also can enjoy it and children don't suffer it. So the soft toys are the one of the commonest reason of the developing the dust allergy. Second thing is the animal dander. So animal dander is also one kind of the inhalation allergies. So many children who has cats or dogs in the house, so that cats and dogs keeps on moving inside the house, they will keeps on shedding their hair into the environment, and as you are sitting there, you keeps on inhaling those hairs and the skin of the animals. That means that is the animal dander, you are keeps on inhaling. Those are the powerful allergen, and that causing the irritation of the nose and the throat, and you will develop the coughing. I remember few of my patients, those who has a quite prolonged cough, longer cough, and every time I ask the history, they don't say that they have the pet in the house. One day the parents were not there and their maid came with the child, and I asked the same question to the maid also. Then she said that we have the 2 cats in the house, and the 2 cats, so they were worried that I will tell them that you remove the cat from the house, so that we were deliberately hiding that history that we have the cat in the house. So then we confirmed that it might be the animal dander allergy. Then we have asked them to trim the cats, to remove their hair, to make the one pet house, so that child is not directly constantly get exposed to the animal dander and his allergy reduces. And rugs, carpets, mainly now there is a fashion to keep the like the rugs which has a lot of fur, and those furs are the very good source which accumulate lot of dust, and those dust are getting inhaled, and we will have the cough, we will have the running nose and the dust allergies. So the common reasons are like this, like the carpets, rugs, animals, then the soft toys, and the most important culprit is the air conditioner. Like many times we use the air conditioner and we don't clean the air conditioner filters. So air conditioner filters are regularly to be get cleaned at least every 2 to 3 months. because the filters of the air conditioner contains the dust, and when this stays there for a longer time, it will form the dust mites, and dust mites keeps on getting suspended into the air, and we keeps on inhaling it. Specifically, once the winter is over and the summer starts, so definitely you require to get the AC filters cleaned, otherwise immediately all the family members will start having the cough. So there is one terminology known as a sick building syndrome. Like the most of the cities has the centralized air conditioning buildings. So what will happen that the duct of the ACs are keeps on collecting the dust, and as it is a dampened environment, the molds and fungus is also developed there, and those molds and fungus also comes out in your room when you will switch it on. So the molds and the fungus are also very highly allergen. They irritate the nose and the throat, and you will have a lot of coughing. So this is known as sick building syndrome. So the buildings which are making you sick, so that is known as sick building syndrome. So those are the brief that what are the kind of the symptoms you develop when you have the dust or the inhalation allergies, and some of the commonest reason of the developing the dust or inhalation allergies. Now what you can do, like you cannot go to the moon or stay, or you cannot go to the Saturn and stay, and you cannot make one small air bubble and you just stay inside. You have to leave. You have to live. Your life should go on, and you cannot just set back that I have dust allergy and I keeps on suffering. So the important steps what you can do at home is which are in that form that it is manageable, like you can do at home. So as I told you, number one thing, like if you have the soft toys, you wrap into the plastic, or maybe you buy the plastic toys. Second thing, the AC filters every 2 to 3 months require the cleaning. Third important thing is the cleaning the house with the vacuum cleaner. Many times the families who are using just the broom, so while you using the brooms, what happen that you just keep that dust suspended in your environment. So this dust will keeps on suspending in the environment, and you will keeps on inhaling. So the mopping will cause the more issues. So vacuum cleaning is important, because in the vacuum cleaning you can suck those dust and you can throw it out. Another important thing is to do the mopping. The mopping at least twice in a day. Twice in a day is required with the warm water, so that it will keep effectively the dust down over the floor, so that you just don't keeps on inhaling those dust. And if you have more symptoms, you can keep one small humidifier in the house. Parents buy the costly air purifiers. Air purifiers are generally not recommended. It is not in there any guidelines to use the air purifier, but what is recommended is using the humidifier. Humidifier is a cost effective way to control the allergies. So those are the steps you can do inside your house, so that you can at least prevent the symptoms of the dust allergy or the inhalation allergies. Second thing what you can do is that, because once you will start changing this environment in your house environment, at least it will take around 3 weeks for the environment to get little bit comfortable. But still if the symptoms persist, then another remedy what you can do at home is doing the steam inhalations. Steam inhalation will helpful in the clearing the nasal secretions and reducing the irritation of the airway, so that body's response will start getting reduced. If all those things not work, like in the initial stages, all these things will work. If it is not working, yes, then you have to go to the doctor. You have to get it checked whether it is really an allergy or something else. Maybe there is some disease also, like something bronchitis, pneumonia, asthma, something is developing that you have to get checked. And based on that, doctor may advise some of the nasal sprays, or maybe some of the tablets or the medication. Then you will start getting better. So friends, what we have learned in this video is, one is a dust allergy. What is a dust allergy, or what is the inhalation allergy? What are the common sources of the inhalation allergies? What are the symptoms of the inhalation allergies? What you can do at home to reduce your inhalation allergies? And then what are the treatments available which your doctors can advise you? So all those things we have summarized in a shorter video, that how to protect or how to treat the dust or the inhalation allergies. I hope you must have liked these informations. If you understood the things, you can press the like button, you can share with your friends, families, colleagues, and let them get educated about the dust allergy and what are the steps they can do at home. Thank you very much.